Assalamu alaikum. How's everyone doing? Just an overview of what we covered in our guide. With lots of the macro factors occurring now, we've realized that this has also hugely affected the third sector too. The cost of living crisis isn't just something that's affected individuals, but the existence of organizations. Muslim charities and individuals are more sensitive to this relative to the rest of the population. We will begin with an executive summary. There were a number of factors that we noticed and discussions of these factors, which the report aimed to offer some steer. These positions should be used as a starting point before we look at any detailed analyses, strategy and implementation. Hence, the dialogue around this is necessary to ensure long-term stability and immediate term relief and assurance. And these are just key takeaways from our report.
Yeah, so we began this research about just over a year ago, and we were looking at that point, we were looking at economic insecurity and how it was affecting churches, charities, faith groups across the country. And we began by asking what economic insecurity is. And very early on, one of our findings was that in the course of the research, actually the nature of insecurity and the whole economy was becoming less secure. This is a quote from fairly kind of the middle of last year, and this is a Church of England vicar saying that economic insecurity is existence in the 21st century, and it was a sense in which kind of life had been like that. So communities had been sort of tipping on the edge. This is just a rundown of a few headlines from the last few months that shows the scale of this and kind of the breadth of this. So we saw during the pandemic, really interestingly, the furlough effect, which was where people who were placed on furlough during the pandemic, often of working age, often younger than the average volunteer, because they were of working age rather than retired, used their furlough time to volunteer. So there were people who previously would have been at work 9 to 5, when they were placed on furlough, used that time to contribute to their communities through faith groups, through local charities. And then obviously that was kind of reversed when they all went back to work, and we saw that subsequent kind of decline in that younger and more able population volunteering. And then lastly, this sort of feeds into something that we termed social scarring. So after economic crises, economists use the term economic scarring to kind of describe the medium to long-term effects of a year ago, and the price of everything was magically lower, and all of these kind of effects that we've seen were gone. There would still be kind of scarring and damage to the economy because the jobs that have been lost wouldn't suddenly appear again. And the same is true, I think, for the social sector, which is why we've kind of termed this potentially a social recession that we're starting to see. But that sort of social scarring is that even if tomorrow morning people woke up and were a lot more comfortable, many of those volunteers who had stopped volunteering would no longer be in a position to suddenly come back. Likewise, some of the organisations that have shut, if they have shut, or if they've withdrawn services, and we know of many charities that have kind of scaled back some of the services that they're offering because of the crisis. That takes time to rebuild, and so the scarring lasts kind of far longer than the economic crisis itself.
So from our perspective, looking at the UK-wide picture and what is going on when we talk about British Muslim communities and the cost of living crisis, I think we should start with the stat, and notably with the recent findings of the census, which the MCB commissioned a report on. So we know that 40% of British Muslim communities are in the poorest localities across the country. We know that 500,000 more Muslims are in socially deprived and poor economic conditions than the previous census. And we also know that there's always been issues of latent health inequalities. We saw that in COVID and so on and so forth. So when you're looking at the cost of living crisis, you're not just looking at it in this moment in time that, oh my gosh, all of a sudden Muslims are really struggling. But what we're looking at is generational and cyclical poverty or social immobility, which has then been exacerbated by these kinds of social conditions. But on the other hand, well, communities aren't just sitting there, and faith communities in particular have been a complete lifeline to providing support. We have heard stories now of institutions really worried about how they're going to pay the utility bills. Some saying that their figures have gone up into 6-7 figures, like some of our mosques are absolutely massive, but the services that they provide are also critical and expansive. The area that I think is the most neglected when we talk about the cost of living crisis, aside from the politics of it, is emotional well-being, care and compassion. And I really like this idea of creating compassionate societies and also societies in which we're all trying to give back. So the national picture is stark, but it can only be rectified if we're working in partnership and collaboration with wider society, wider agencies.
We are traditionally an international NGO. We have been working for nearly 40 years around the world, and responding to crises and emergencies in very far-flung countries. But over the last couple of years, we've noticed the growing need in the UK, and we are not unaware of the growing need, particularly of the Muslim community. And we've taken a strategic decision to also focus a little bit more on what's going on at home in the UK for us. A little bit about how we're responding to the cost of living crisis. So we're sort of doing this in two ways. I talked a little bit about our programs and our UK program initiatives, and we're doing that by working through our partners. We're supporting a lot of food banks, and it's been really interesting, slightly depressing, I'll be completely honest, to hear from some of our partners this year about increased need. And they're talking about seeing need on unprecedented levels, at levels that they've never seen before. They're saying to us, they're reporting to us that not only are donations down, as Hannah was pointing out, but also that they're just having so many more people referred to them, they can't quite cope with the demand. So we're asking for the government to do a few things. And one of the basic things that we think that should be done and could be done is to bring back the uplift in universal credit. We think that the £20 uplift in universal credit that was set during the pandemic was great. It helped families. It doesn't go far enough, but if it was made permanent, it would certainly provide a lifeline for people when they're trying to make ends meet at the end of a week. We also want to ensure, or we want the government to ensure, that debt reductions are paused for benefits and from universal credit. Again, this was done during the pandemic, and we recognise that actually what that will do is it will mean that people will be able to afford their energy bills. It will mean that people will be able to afford some of those other costs that they're now having to face. As inflation goes up, the cost of everything is going up, and if people are having to focus on debts, they're much less likely to be able to afford some of those other basic requirements. We ultimately think that the government needs to undertake a fundamental review of the UK social security system. What we're saying at the moment is that the social security system in the UK is not providing the safety net that communities need.
The cost of living, from the cases of the people that we're helping with, is perhaps a term, which might imply if people had just a little bit more to get by, things would be okay. But I think we need to start talking about a Muslim poverty crisis, which is very much what the data is speaking of. We, at NZF over this last year, we've been seeing almost a steady doubling of people asking for help over the year before. It certainly caused a strain on our systems, and we've been trying very hard now to figure out new ways to work through a backlog that has been increasing over this last year. We have had on average an application for Zakat support every 40 minutes over this last year of 2022. We sponsored a Muslim census survey, which showed, quite dire, data of 1 in 5 Muslims now in the UK. This was a survey taken in October of 2022. 1 in 5 Muslims in the UK now saying that they had to use a food bank. 1 in 3 Muslims saying they missed a meal to help them pay for bills. 65% of those who were asked saying they took on some form of debt to help pay for their bills and basics. 25% of Muslims in the UK saying they asked for some form of zakat. I'm not saying for NZF now, just in general, some form of zakat they look for to help them within the United Kingdom. So we really do have something that needs to be called a Muslim poverty crisis of some sort within the United Kingdom.
The type of people that are coming to utilize our services are largely much more varied than we anticipated. So we were expecting homeless people extremely low poverty, but we've actually got people that are working families, people with children that just can't afford to, provide those meals. They've had to make very difficult choices between either heating their homes or providing those meals. So they've actually come to and utilize our services to be able to have that location where they know 7 days a week that they've got that access to a warm meal. So that's one area. The other things that we've seen in that is the fact that there's a lot of worry, a lot of anxious people. They're seeing the cost of their living going up. They're looking at energy prices going up, but what they're fearful of is that those prices going further up. So you've got a level where people are saying actually it's really bad, we've been told, and the forecast and everyone's saying that it's got to get worse. You see, and that fact that the government hasn't been able to fully kind of cap the energy prices going up is causing so much stress. How can we help people in alternative ways? So we've been exploring different actions and different areas. Our UK Qurbani app, kind of Muslim hands, has substantially increased. I think we've gone from about 40 animals that we used to do to over 150, and we're looking at doing inshallah, over 400 this year if we're able to get the right kind of permissions and so on. Because there is a demand from our local community for actually supporting and providing the meat, but also actually people do recognize that the situation is getting bad and the need that there is in the UK.
Cosmos was able to set up a lot of food banks within our masjid affiliates. We have around 6 masjid affiliates with Cosmos, and all of them sort up food bank. And as rightly pointed out by the panelist, there is a big need for a change in the way that the government thinks about the support and the universal credit and all those stuff. But as Gordon Brown rightly pointed out, Hannah put that slide which really touching. It is not about the universal credit that it supports now. It is about, on the forefront, it is about the charities and the community organizations and the faith groups take a big one-to-one human touch where the government fails to understand.
I think for the purposes of today, I'm going to talk more about iCare. iCare is an initiative set up in 2016. Now, it's part of UKIM, but what it does is it basically provides the community cohesion work, the relief work, and delivers on the ground. It's specifically targeted and focused on the UK. And there's this theme that's been talked about, I think, with all the charities and all charitable organizations and speakers today, that there tends to be, and there has been over the course of the last 5 to 6 years, more focus on relief work and helping those in our own communities in the UK, be it Muslim or non-Muslim. So community cohesion, absolutely essential. And I think iCare plays a huge role in this because it doesn't differentiate. It provides a service irrespective of faith, race, and background. Some of the issues it addresses is poverty, homelessness, environmental issues, fostering, which is an issue particularly in the Muslim community. It's an issue in the UK generally. The refugees that arrive in the UK and providing services for them. Another thing that they do, which I think is very unique, is that they encourage and try to raise the aspirations of the local community, of course the Muslims and those others who attend the centres as well. Loneliness, a huge issue within the UK, is something that iCare has been working on recently as well. The way they're able to deliver these services is by working with the local authorities, with multi-faith organisations, Fair Share, they work with those. My Foster Family, a recent initiative where gift packs have been issued to families and to individuals, to those who are living with non-Muslim families as well, because there's such a shortage of fostering parents in the Muslim community. And it's something we've done loads of events at our masjids, our mosques throughout the UK, where we're encouraging people to take on foster children. Since then, we're part of the Warm Welcome campaign with the cost of living crisis, which is obviously pertinent today. It's a huge issue. And I've always said that mosques and community centres, they're huge multi-million-pound buildings. And if they're only utilised for the purposes of salah, which takes place 5 times a day for about 10 to 15 minutes. You've got a huge building which can be used for so many other things, hence the community aspect and actually integrating and working with communities.
And with that, we'll end this meeting, inshallah.